Your doctor has asked that you watch this entire video to better understand the procedure they are recommending. Every procedure involves some degree of risk, and some of the more common risks related to your procedure are discussed in this video. Please note that the majority of patients, higher than 95%, have successful surgery without serious complications. Even so, your doctor is required to ensure you are aware of the most common potential risks. You will have an opportunity to discuss any concerns or comments you have with your provider after you have watched this entire video. Please watch and listen to this entire video that covers the explanation of your procedure and the informed consent process for shunting. You cannot undergo surgery unless you acknowledge you have listened and understood the entire video. Hydrocephalus is the condition in which excessive fluid builds up in the brain. Specifically, the fluid that builds up is called cerebrospinal fluid, or CSF. This is the fluid made by the body and surrounds the brain and spine, providing a protective cushion layer for the brain and is thought to have an important function in clearing out the brain's molecular waste. Cerebrospinal fluid is made in the center of the brain in spaces called ventricles, and then travels through a series of compartments until it finally ends up in the space surrounding the brain and spinal cord. Here it is taken up by little cells on the surface of the brain and then recycled back into the body. Every day, we produce new spinal fluid, and then that same amount of fluid is reabsorbed back into the body. This creates a balance between what is made and what is removed. Hydrocephalus occurs when there is an imbalance between what is made and what is absorbed, creating a backup of fluid in the brain. Ultimately, this overproduction of cerebrospinal fluid can create a buildup of pressure that can cause injury to the brain. The symptoms of this condition can be as mild as headaches or head pressure, but can become more severe as the pressure builds up, potentially leading to a constellation of other symptoms. These include severe lethargy, coma, and potentially death. Likewise, it can result in dysfunction of different parts of the brain and cause vision changes, unsteady balance, incontinence, nausea, vomiting, or confusion. A number of conditions can lead to the formation of hydrocephalus. These can include conditions that occur at birth or congenital problems. Additionally, a number of conditions can lead to the development of hydrocephalus later in life, including brain trauma, tumors, infections, bleeding, cysts, obesity, brain malformations, prior brain surgeries, and idiopathic or unknown causes. There is also a common condition in older patients referred to as normal pressure hydrocephalus, whereby the patients do not have pressure buildup but develop a gradual overproduction of cerebrospinal fluid that results in a classic triad of symptoms, including dementia, incontinence, and gait instability. In some instances, hydrocephalus can be transient and improve with time. This depends on the type and severity of the disease. For most cases, however, the definitive treatment requires surgical intervention. The most common treatment is a procedure called shunting, whereby the excess fluid is removed from the brain and diverted to a different part of the body to be absorbed there more adequately. The most common type of shunting is ventriculoperitoneal shunting, or VP shunting. This involves placement of a small rubber catheter, or tubing, into the ventricles. These spaces where the cerebrospinal fluid is made are then drained, and the catheter is passed under the skin all the way down to the abdominal cavity, called the peritoneum. This space surrounds your intestines and other organs and has the capability of absorbing the excess spinal fluid that is shunted from the brain. In other, less common situations, it may be necessary to drain the spinal fluid from another part of the body. This may be the lumbar or lower back region, and this is called a lumboperitoneal shunt, or LP shunt. Similarly, if the peritoneum is unable to absorb the excess fluid for some reason, it may be necessary to drain the excess fluid into another receptive area, such as the atrium of the heart, an atrial shunt, the space around the lungs, a pleural shunt, or the gallbladder. The procedure typically takes roughly 1 to 1.5 hours to complete. For the case of ventriculoperitoneal shunting, it involves making a small incision on the head, making a small hole in the skull to pass the catheter through, and then passing the catheter directly into the ventricle using special navigation software. This navigation software utilizes a CT scan or MRI that was obtained before surgery to help the surgeon place the catheter precisely. The catheter is then attached to a valve that is pressure regulated. This pressure-regulated valve prevents the shunt from overdraining the spinal fluid in the head and only allows the spinal fluid to flow through the shunt when the pressure in the brain gets above a certain point. This valve sits under the skin with the remaining catheter and rests on top of the skull. It will not be directly visible, but may feel like a small bump on the skin surface. This valve is then connected to another catheter that is passed under the skin to the abdomen, where it is passed into the peritoneal cavity. In some situations, the neurosurgeon may have a general surgeon place the catheter into the peritoneum using laparoscopic cameras to ensure good placement of the catheter. If you have had prior abdominal surgery or surgeries, please make sure your surgeon is aware prior to your procedure so that he can determine whether a general surgery is needed for laparoscopic assistance. After surgery, you will have a CT scan performed to visualize that the catheter is in the desired location within the brain. Most patients will be watched overnight in the hospital and are safe to be discharged from the hospital within 1 to 2 days, barring any other medical conditions or complications. Most patients have soreness for several weeks that is managed with pain medications prescribed at discharge. Often, patients feel better immediately from their hydrocephalus symptoms with placement of the shunt. However, it may take several weeks for the cerebrospinal fluid pressure to normalize. In some instances, symptoms may not improve if the hydrocephalus has caused permanent injury to the brain. Risks and benefits. Although generally safe and very well tolerated, cerebrospinal fluid shunting, along with all surgeries on the brain, have some risk. As previously mentioned, persistent symptoms after the surgery are possible and can occur in all cases. The rate of this occurrence depends on the type of hydrocephalus and the specific symptom. Please ask your surgeon if you have concerns about the likelihood of success for improvement of specific symptoms. The most common risk of shunting procedures is the need for further reoperation to fix the shunt if it stops working and fails to drain an appropriate amount of cerebrospinal fluid. Possible causes for shunt failure include the catheter or valve getting clogged, disconnection or breakage of any portion of the catheter, migration of the catheter to an undesired location, valve failure, or infection. In children, it is possible for the child to outgrow the shunt as they develop. It is estimated that in adult patients, the risk of having shunt failure requiring revision is about 24%, with the vast majority of these complications occurring in the first year after surgery. This may vary depending on the indication for shunting. This rate is higher in children, where most children will require 2 to 3 surgical revisions before they are an adult. In the event of a shunt failure, you will need to return to the operating room to have the shunt explored to determine the non-functioning part and have it replaced. Shunt infection is the second most common cause of shunt failure and typically occurs within the first few months after surgery. Late infections can occur if the shunt becomes infected by an outside infection, such as an abdominal infection, sepsis, or meningitis. Modern reports indicate the risk of infection are about 6 to 10%. In order to minimize this risk, all patients receive antibiotics at the time of surgery, and extremely sterile conditions are employed at the time of implant. Additionally, most modern catheters have antibiotics impregnated into the surface of the rubber to help prevent bacteria from growing on the shunt. When shunt infections do occur, the entire shunt symptoms needs to be removed. Typically, a new temporary catheter is placed that drains outside the body, called an external ventricular drain, which stays in place until multimicrobiology culture samples of the blood and spinal fluid demonstrate the infection has cleared. At this time, the shunt can be reimplanted. Typically, this requires 1 to 2 weeks of hospitalization and long-term antibiotic treatment dictated by an infectious disease specialist. If the CT scan obtained after surgery demonstrates inappropriate catheter position, or an X-ray shows that the catheter has backed out of the belly, you may need to return to the operating room to have the catheters repositioned. The rate of this complication is low, but may occur in 1 to 2% of cases. There is always a small risk of complications in the abdomen from the shunt catheter. This includes injury to the bowel or development of a fluid collection in the abdomen called a pseudocyst. The risk of these complications is low and ranges from 1 to 4%. A second procedure may be required to treat these complications if they occur. Bleeding is always a risk with surgery. In most cases, bleeding from shunt placement has no consequences and can be observed. Bleeding can also occur in rare circumstances where too much cerebrospinal fluid is draining from the shunt. This complication is more common when shunting is performed for normal pressure hydrocephalus. If this occurs, the shunt may need to be changed to a higher pressure setting or removed. The overall risk of bleeding from this surgery is very low, typically less than 1%. Shunts operate by allowing fluid to flow when the pressure is higher than a specified setting. There is always a risk that the setting of the shunt is incorrect. Some shunt valves have multiple pressure settings that can be changed with a magnet over the skin. This can be performed at the bedside or in the office by your neurosurgeon if deemed necessary. If the setting cannot be appropriately changed or the wrong type of valve is implanted, surgery may be required to change your valve to one with different pressure settings. Surgery of any kind, particularly brain surgery, can be stressful for your entire body. Although uncommon, certain medical complications can occur after surgery, in up to 5% of the cases. These are more common in patients over 60 and those with multiple medical problems. Brain surgery and all anesthesia raises your risk of developing blood clots in your legs, also known as deep venous thrombosis. If this clot breaks off, it can go to your lungs, causing a pulmonary embolus. Clots in the lungs can be catastrophic, and in 1 to 2% of the cases, death can occur, albeit rare. The risk of death with this procedure is about 0.1% at large centers commonly treating this condition. Obese patients, diabetics, chronic opioid users, those on disability, smokers, those involved in a lawsuit, or recent motor vehicle accidents. Your doctor may do anything else he or she deems necessary at the time of surgery. This includes aborting the surgery, placing a temporary catheter or external ventricular drain, changing the side of the body on which the shunt is placed, or change the desired location of the catheter tip. If the shunt is being revised or fixed, it is up to the surgeon at the time of surgery to determine which components are not functioning and need to be replaced. Your doctor reserves the right to make decisions in the operating room at the time of surgery in your best interest if deemed necessary. Your surgeon will be present for the critical portions of your procedure. Our facility is a teaching institute, and therefore, residents and fellows are expected to participate in you receiving the best quality of care. There is a possibility that your doctor may be running overlapping surgeries in multiple rooms. At times, there may be observers, such as surgeons from other institutes or students, present in the operating room. Thank you for watching this informed consent video. Please contact your provider if you have any further questions or concerns.